We go now to antibacterial agents. Antibacterial agents, these are agents used to fight against or kill bacteria. But antibacterial class, take note, is a type of antimicrobial agents. Usually we focus more on antibacterial, and later we will discuss the antimicrobial, because antimicrobial drugs, this includes not only antibacterial but also antiprotozoal, anthelmintics, okay, and antifungal agents. Antimicrobial drugs, these are chemicals used to treat microbial infections. When you say microbial infections, these involve uh, different microorganisms, the fungi, protozoans, the helminths, and of course the bacteria. Before antimicrobials, there are large people died of common illness, or they died because of the infections. That is infections caused by different microbes or bacteria, fungi, and protozoans. Now, many illness easily treated with antimicrobials because of the availability of the different drugs, of different antibacterial drugs or antimicrobial drugs that are marketed, that are being manufactured by the different company. However, many antimicrobial drugs are becoming less useful because of the bacterial cell resistance. Because one reason is that the problem for patient compliance. For example, antibiotic is being what they call this one, uh, prescribed by the doctor. Then the prescription calls for 21 capsules of certain antibiotics, and the patients can only take 9 capsules for 3 days, because it is 3 times a day, 9 capsules of that antibiotic. So, and after that one, the patients will stop. So the bacterial resistance will follow and will start, because antibiotic drugs interact with the protein of the bacterial cells, and there is the tendency of protein alterations, or even acquiring of the genes by the bacterial cells to resist with a certain treatment of antimicrobial drugs. Next, antimicrobial drugs, we have the chemotherapeutic agents. These are agents used to treat a abnormal cell growth known as neoplasm, or chemotherapeutic agent is also known as anti-neoplastic agents. These are agents used to treat cancer. And antimicrobial drugs. So different types of antimicrobial drugs. We have antibacterial drugs, antifungal, protozoan, and anthelmintics. So when you say antibacterial, these are drugs used to kill the bacteria. Antifungal used to uh, treat or kill fungal infections. And antiprotozoans, these are drugs used to treat protozoans, protozoans infection, I mean. And anthelmintic, these are drugs used to kill helminths or roundworms. Example niya, mga pinworm. Pinworm is Introbius vermicularis. We have also Ascaris lumbricoides, the roundworms, the wickworm, okay, Trichuris trichura. These are example of helminths. So later on, we'll discuss this one in the finals about helminths. They are also known as parasites. So other terms related to antimicrobial medications, we have acquired resistance. So this is resistance developed through the mutations or acquisition of the genes by the bacterial cells. The acquisitions and mutation of genes, these are the bacterial cells acquire this one through the interactions of the antimicrobial agents with the protein part of the bacterial cells. So there is what we call mutations, at the same time modifications of proteins, which leads to resistance that is acquired. Okay, antibacterial drug, an antimicrobial agent used to treat the disease caused by a bacteria, or kill the bacteria caused the bacterial infections. Antibiotic, these are compound naturally produced by certain molds and bacteria that inhibits the growth of or kill other microorganisms. For example of that drug is we have erythromycin. Erythromycin is coming from Erythromyces. Or we have Streptomycin from Streptomyces griseus, diba? These are microorganisms, the lactobacillus also. Okay? The antimicrobial drugs or antimicrobial, a chemical that inhibits the growth of or kills microorganisms. The term encompasses antibiotics and chemically synthesized drugs. So there are a lot of synthetic antimicrobial agents that are now present in the market. Okay? Antiviral drug is a drug that interferes with the replication process of the virus. All antiviral are chemically synthesized, none are antibiotics. Yes, mostly antiviral are chemically synthesized also. And antibiotics cannot treat viral infections. Bactericidal, an antimicrobial drug that kills the bacteria. Bacteriostatic, antimicrobial that inhibits the growth of bacteria. Broad spectrum antimicrobial, the antimicrobial that is effective against wide range of microorganisms, often includes both gram-negative and gram-positive. So tawag na broad spectrum. So pwede siya to treat different bacterias and even different strain of bacterias. Okay? When say chemotherapeutic agents, a chemical used to treat a certain disease, okay, or a certain abnormality of the tissues caused, for example, caused by cancer cells. And we have your intrinsic resistance. This is resistance due to the inherent characteristic of microorganisms. So intrinsic, it is the resistance within the characteristics of certain microorganisms. So the resistance class, it depends upon the interactions of the protein part or the protein of the bacteria and then with the drug. So usually yung alam na yun, pag alam na ng bacteria, example, reseta si doktor ng antibiotic for 7 days, so that is 3 times a day, so that is 21 capsules. The patients did not comply with that order, so 3 days lang nag-stop na siya kasi ayaw na siya kuno. Pero take note, in that within that 3 days, the bacteria has a tendency to develop already the resistance. Kasi kabalo na siya kung ano ng structures ng drug. So, they can able to resist by the gene modifications or even mutation process. Narrow spectrum antimicrobial that is effective against limited range of microorganisms. So, limited lang siya kung gram-positive, gram-positive. Kung gram-negative, gram-negative lang siya. Okay? So we have R plasmid, a plasmid that encodes resistance to one or more antimicrobial drugs. We have therapeutic index, measure of the relative toxicity of the chemotherapeutic drug. It is the lowest dose toxic to patients divided by the use of the therapy. So features of antimicrobial agents. So the modern antibiotics, most modern antibiotics come from species of microorganisms that lives in the soil, diba? Mostly kung antibiotics siya, usually coming from the soil, the microorganisms. To commercially produce, number one, you have to select the strain. Anong strain ba yan ng microorganisms na gamitin para sa to be used as antibiotic. So you have to grow in the broth or liquid medium. When maximum antibiotic concentration reach, okay, so extract from medium. So usually kung tama na kadamo, so pwede ka mag-extract. Then ano pa? You have to purify or undergo the purification process and chemical alter to make it more stable. So you have to synthesize or to prepare it chemically. Next, features of antimicrobial drugs or selective toxicity. Cause greater harm to microorganisms than to hosts. Okay? So the chemotherapeutic index, the lowest dose toxic to patients divided by dose chemically used for therapy. So we have selective toxicity. So the efficacy and toxicity should be balanced. So hindi pwede na mataas yung toxicity tapos maliit yung efficacy. So much better balance yan. Okay? So kung ang level of the toxicity and the level of efficacy is almost balanced. Hindi pwedeng mataas yung toxicity. Or pwedeng mataas yung efficacy niya, lesser yung toxicity. O kung taas yung toxicity niya, lesser ang efficacy. So usually, balance lang. Mas maganda yung balance. Okay? So chemotherapeutic index, toxic dose over the therapeutic dose. Okay? Kasi yung meaning talaga ng chemotherapeutic class index is more on the treatment of disease that is chemotherapeutic. So may mga chemotherapy, usually that refers also to treatment of cancer cells. Okay? Chemotherapy ang term yun. Chemotherapeutic, that is more on the treatment of the disease. Features of antimicrobial drugs. So we have bacteriostatic, that is inhibition of the growth of bacteria. So inhibit lang yung growth. So to inhibit the growth class, you inhibit also the multiplication process, or the multiplication process, or the limit the what we call this one, the quantity of bacteria. Okay? Bactericidal, that is killing of microorganisms. So the spectrum of activity or the spectrum of actions of every antimicrobial drugs. Number one, they vary to respect range of microorganisms they kill or inhibit. So depende yan sa range, depende sa population. So the more the microorganisms, of course, there is what we call is low effectivity ba drug. Kung lesser yung population, mas mayo kasi dasig yung effect niya kasi gamay lang ang the bacteria will going to inhibit or kill the small population of microorganisms only. Unlike large, so it requires also larger concentrations. Some kill only limited range, so narrow spectrum. So limited range and narrow, or wide range, that is broad spectrum antimicrobial agents. So these are example. Example, penicillins. Penicillins is gram-negative, gram-positive for chlamydia. So this is considered to be narrow. Sulfonamides. So this is narrow. Streptomycin is only mycobacterium and gram-negative. So penicillins can be a broad spectrum. Okay? Kasi gram-negative and gram-positive. Okay, tapos chlamydia pa. Tetracycline is a broad spectrum, but because of the toxicity in the teeth, usually nakakabuk ang unto kung sige katik tetracycline. So tetracycline has been removed the market. So mayroon na doxycycline. Okay, that is another what we call this one, antibiotics coming from tetracyclines. We have isoniazids, polymycins, and vancomycins are considered to be narrow spectrum of action of antibiotics. So effects of combining drugs. Combinations are sometimes used to fight infections. So we have synergistic effect. So the action of one drug enhances the activity of another or vice versa. So example po diyan is the cotrimoxazole plus metronidazole. So yung cotrimoxazole mo have to increase the effect of metronidazole in treating protozoans. So penicillin plus streptomycin, ito yung combination of drugs used to treat endocarditis. Penicillin plus aminoglycosides, so yan sa mga Streptococcus viridans. Penicillin plus gentamicin, used to treat Corynebacterium infections. Cipazolin, aminoglycosides. We have Klebsiella pneumoniae. The antagonistic activity of one drug interferes with the action of another. So example, bereferin plus linezolid. So there is antagonistic effect of your beneferin with linezolid. So features of antimicrobial drugs and adverse effects. So allergic reactions. Some people develop hypersensitivities to antimicrobials. So this one, allergic reaction, it depends upon how the body or how the immune cells of our body responds to the antimicrobial agent. If they are very sensitive or nagkaroon ng hypersensitivity, so magkaroon ng allergic reaction yan. So nagkaroon ng rashes. Okay? So it depends upon the structure or depends upon the concentration, I mean also of certain antimicrobial drugs. Toxic effects. Some antimicrobials has toxic and high concentrations or cause adverse effects. Usually, high concentrations leads to toxicity. Suppression of normal flora. When normal flora killed, other pathogens may be able to grow in high numbers. So, there is what we call opportunistic organisms. Kasi kung ang mga normal flora, example yan, yung mga lactobacillus, okay? So, Fusobacterium or bacteria that is present already in the intestine. So, if they are being killed by these antimicrobial agents, so other pathogens or microorganisms will be able to grow and will cause another infections. So, resistance to antimicrobial drugs. So, some microorganisms inherently resistant to effects of particular drug because the resistance I mean of microorganisms develop when during the interactions of the protein of a antibiotic with the antimicrobial agent. So there is what we call a chemical interactions between the two.